Hi everyone, it's Big Papa Scott here again, talking a little bit about the heart still. I wanted to show you a couple of the imaging techniques that we use to look at the heart. On the left, there are two pictures from an echocardiogram, and on the right upper part you see an MRI, which is magnetic resonance imaging, I think is what that stands for. Basically, it uses big magnets to rearrange molecules and take pretty pictures. So, anyhow, an echocardiogram is sound waves. It works on the same principle of sonar that they used in World War II to look for submarines, and still use sonar now for a lot of other things, even in fishing boats. So, what they did was refine it quite a bit and made it so that we could see the heart with a very expensive machine. This is the test that I did, the echocardiogram. So these are pictures of what looks like adult echocardiograms. So, just what's called a four-chamber view, which is right up here, and a short axis view right here. Those two views are used to evaluate valves, the function of the heart, the size of the heart, whether there's any chamber dilation or dilatation, whatever you want to call it. And it also is a good way to look at the overall function of the ventricle, which I should change colors, but here's the left ventricle, cutting it like through the chest from the left shoulder to the right hip. So if you were to take a kind of a big slice out of a person and put it on that angle, that's what you'd see, is that short axis view of the left ventricle. And in the next one, I'm going to show you some live images, as soon as I figure out how to put them in the presentation, of what the echocardiograms look like. The MRI is also live and can show quite a bit too. Shows chamber size, and the one issue that they have is blood flow. We can see blood flow on the echocardiograms by just turning on what's called Doppler, which Doppler is, we have color flow Doppler, which just shows us the flow going through in a bunch of different colors. I would go into the explanation, but it's way too complex. We can also get the velocity of blood flow in meters per second, so we know how fast the blood's leaving or going into the heart. So the echocardiogram is really a good way to look at the heart. It's been the standard for many, many years. If you look at an MRI, which is the one up here, I just crossed over the MRI part, you can see that the chambers are on the bottom. The RV and the LV are the pumping chambers, right? And this is the left atrium and the right atrium. And this tracing that is going around in red is just a way of measuring the size of the left atrium. Now, years ago, even before I started doing echocardiograms, so, probably in the 1970s or 80s, early 80s, 70s most likely, some doctor decided when they got 2D imaging into the picture where they could look at the heart in live shots, like this particular picture here, some doctor decided that it was easier for them to look at this picture in this plane and also in this view, where the atriums are on the bottom. Let me see if I can change colors really quick. The atriums are on the bottom and the ventricles are on the top of the screen. Now, in my opinion, this was always completely backwards and very confusing to most people. In pediatrics, when I do pediatric cardiology, we flip this the other way so that it looks more like an MRI picture, or this anatomical picture down here. But it is the way it is for so many years because one guy decided that this is the way that they should look at it. So no one's bothered to change it. I don't know why. It doesn't make any sense to me at all. I've asked many times why they don't change it, and the answer is always the same. Well, we've always looked at it this way, so it's too hard to change. And doctors have an extremely hard time changing anything. The view down here, the picture right here, is just a picture of the electrical activity in the heart and how that works. So in kind of a quick scheme or quick showing, this up here, this little yellow dot that is called the sinus node, if you can see it there, sends a electrical signal down to this node, which is called the AV node, and then that sends another signal, another bat of electricity, to this, which is called the Purkinje Fibers, and they go around the heart like this. This is called the bundle of His right here in the center, and that goes all the way around and makes the heart contract. So that electrical activity that goes through the heart makes it contract. The blood is pumped through the heart and out into the body and into the lungs, and then the heart relaxes and everything recharges, and then the whole thing starts over again. So you get another firing and another firing, and it just keeps going on and on like that. That's kind of a simplified, if an electrophysiologist heard me say that, he'd probably have a heart attack. But, sometimes you got to explain things so that everybody understands, not just the medical people. So I wanted to go over this just to give you an idea of some of the imaging techniques that we have to look at the heart and how it can be seen in quite a few ways. There also is one other thing I want to talk to you about. Cardiac catheterization. I just put cardiac cath there because that's what we call it, for short in the medical industry. Everything is shortened in the medical industry. We don't try to use the big terms that they give the machines or the tests or anything of that nature. Everything has an abbreviation. So cardiac cath is an invasive test, which means they do have to puncture the skin, excuse me, and they go in usually through the groin area between the hip and the inner thigh, and they find an artery and a vein there, and they run catheters, which are small little, first they start with a wire, and then they run a little plastic sheath over the wire, and they run it up the vein and up the artery, and they get it into the heart. And let's say, whoops, sorry about that. If you were to look at the heart and how it is drawn out, what you see is, the aortic arch kind of comes like this. Sorry, I'm drawing that not perfectly. And then goes down throughout the body. And the catheter comes up this way and goes to, just drawing them from freehand, they're not exactly in these places, but into the coronary arteries, which are here and here, and they inject a dye that lights those up and shows if there's any blockage in the heart. So if you can imagine that the heart were here, when they inject the dye, it goes down these little arteries, and they also have branches and everything of that nature. Whoops, didn't mean to do that. But they have branches that actually come off the heart and off the arteries, and the dye will go into those too. And they look for any kind of a blockage. So I'll explain a blockage to you in just a second. Now, when an artery gets blocked, let's say the blood flow is going this way. What happens is, over the years, people can gather what's called plaque, which is a combination of fatty tissue and platelets and all this other stuff, just a bunch of junk that's floating around in the arteries because maybe you don't eat well, or maybe you have bad genes. That is, they are finding out, is probably more important than they ever thought. So if your father died of a heart attack at 45 and your grandfather died of a heart attack at, let's say, 50, then you at 30 need to go in and have your heart checked, because that's a sure sign that you're going to get early coronary artery disease. So if they put you on cholesterol-lowering medicine, then you may avoid it, which would be great. But as time goes by, these blockages, they get bigger. Yeah, hold on a second. And as they get... What the heck did I do? Sorry about that, folks, but I'm just learning this program, so anyhow. The blockage will look like this and will, like I said, gather over time, and it keeps getting bigger and bigger to the point where it's probably about 80% blocked, maybe 90% blocked, something of that nature. And for some reason, in some people, they have a they actually can form clots, little blood clots in the center. Here, let me just try to draw one here. Oh, no, I'm moving it again. So I drew the clot in there. I figured out what I was doing wrong. And this blood clot, see that represented by this little black circle here just above the arrow, will eventually come here and get stuck right in the artery. That will block flow past the artery, past this point. So anything from here and beyond dies. So if it's heart muscle, well, then you have a heart attack. And part of the heart muscle will die if they don't find a way to dissolve that clot and then open up the artery. And we'll get into that later. This is also true with strokes. If you have a small blood clot, it goes into a blockage that's maybe in your neck or up in your brain. It can cause a stroke, because once that blood flow is blocked going up to the brain, that area of the brain will die because it does not have enough blood flow and oxygen getting to it. So it dies, you have a stroke, and you have a permanent weakness on one side, and it can be devastating, just like a heart attack can be too. So this also is true for patients with, let's say, bad circulation down in the lower legs. They can have a clot go to the artery, and the leg will turn blue, or part of the foot will turn blue, and if you don't watch it, they get gangrene and it will completely need to be amputated. But nowadays we have things that we can use to open these blockages up, and I'll explain that in a later one because I think it needs to be explained with some pictures. So we're going to do that. Anyhow, I wanted to show you what a blockage looked like and some of the imaging techniques. So I hope you enjoyed this one. It was a little longer than I usually like to go, but anyhow, we'll see you on the next one.